Is it normal for teenagers to have irregular periods? What causes irregular periods in teenagers? When teens first start their period, a lot of unusual things can happen, like getting their period every other week, not getting their period for 2 months, or getting their period for a longer time. This is a normal part of puberty. Their cycle is getting ready to become just that, a cycle, and it can take up to 2 years to be a steady cycle, and for some it never does. Sometimes irregular periods are caused by factors other than normal development. For instance, some medicines can cause irregular periods, as can exercising too much. Not eating enough calories or having a low body weight, or even a high body weight, can cause irregular periods as well. Point 1. There also is a chance that hormone imbalances are causing an irregular period. When thyroid hormone levels are too low or too high, that can cause issues with the period or even make them irregular. Extra androgen, which causes hair growth on the face, chin, chest, and abdomen, also can cause irregular periods, as can being pregnant. In this case, a teen will not have a period at all. Ways to cope. If your teen is struggling with irregular periods, there are some things you can do to support them until their menstrual cycle becomes more regular. For instance, you can begin by encouraging them to keep supplies on hand should they need them. Help them brainstorm areas where they can keep tampons or pads in case of an emergency, such as in their backpack, locker, purse, car, and other easily accessible areas should their period arrive when they least expect it. They also may want to consider wearing menstrual underwear such as Thinks to avoid any embarrassing accidents, or wear a panty liner when they are expecting their period to arrive. It also can be helpful to teach them how to recognize the signs that they are about to start their period. These are different for everyone but can include tender breasts, food cravings, grumpiness, bloating, and sometimes even acne. When to call a healthcare provider. Keep in mind that there are some symptoms that should prompt you to see a healthcare provider so that they can assess the symptoms, make a diagnosis if an underlying condition is causing the problem, and recommend a treatment to help regulate the menstrual cycle. Some signs that you should talk to a physician include the sudden absence of a period, regular periods that become irregular, periods that are very heavy, periods that last more than a week, periods that occur more than every 21 days, periods occurring less than every 45 days, spotting or bleeding between periods, severe cramping or abdominal pain. That said, if your teen is showing no other signs, like being extremely lethargic, getting sick to their stomach and such, just keep an eye on them. However, calling a healthcare provider to get an opinion is always a good idea.